Hello and welcome to Senior Connections. This is our monthly look at all kinds of topics that relate to older adults, their caregivers, and anybody else interested in those kind of topics. We are talking about a range of things from services to prescription benefits, and today we're talking about a really important and maybe not so known for older adults topic, opioids, and issues related to that. So I'm very excited. I think this is going to be a great half an hour. We're happy you're with us. And I'm happy to have with me Jill Montgomery Keast from Public Health and Dr. Jerry Evans from Mercy Health. Welcome, both of you.
It's great to be here.
We're going to, we hear about opioids all the time, but a lot of times we're talking about younger people we think about. But let's talk about how this relates to older adults, and we've got a lot of questions. So that's why I cut short the intro kind of thing, because it's been discussed a lot in the media, but let's talk specifically. So. But let me get a little bit of background about the two of you real quickly. Jill, why don't you tell us a little bit about your role at Public Health, how long you've been there? And
I've been there 20 years.
Started as a baby.
Started as a child, that's right, little kid. 3, I think, was the starting age. I oversee the Substance Abuse Prevention Unit. I am also on the Opioid Task Force here in Muskegon County.
Wonderful.
Yeah.
And Dr. Evans, tell us a little bit about you.
I've been here in Muskegon for 23 years as an emergency physician. I'm currently the director of the emergency departments in Mercy Health Muskegon, and I'm also on the Opioid Council.
Wonderful. So we've got pretty knowledgeable people here. So let's get right to this. Dr. Evans, what are opioids? We hear that term, and I think a lot of times people don't know whether they've got opioids in their house. So talk to us about that.
So opioids were originally developed back in the 1800s as a pain medication, often for the military at that time, and it was a derivative of a plant. The original ones were, and that's heroin and morphine. Actually, morphine was the first one that was developed. Morphine was developed as a pain medication. It was used extensively after war for injuries, and then people started getting addicted to that over time. Since that time, many more medications have been developed. So opioids are a class of medications that involves any drug that affects the opioid receptors on the cells in the brain and spinal cord. Okay. So, for example, oxycodone, OxyContin, a number of other medications, Norco, have been developed that are used for pain relief.
Okay, so some of those could be in somebody's medicine cabinet at
Absolutely.
home.
Yeah.
So it's funny when you said morphine, I immediately go to those old war movies or something where you say, "Doctor, give me morphine," and I think that's what a lot of times we think of when we think of opioids.
And a lot the heroin issue. When people say opioids and overdoses, they just relate it to the heroin.
Right.
That's not necessarily the case, Lisa.
So let's talk a little bit about that. There are legitimate uses for opioids, lots of them, as you said. It's pain relief.
It is pain relief, but short-term pain relief primarily. Okay. So we use it for a person who has a broken bone or an injury or a bad burn or something like that. We may use opioids for short-term pain relief for that person. But the longer you're on it, the more resistant your body gets to it. So then you need more, and then you need more, and then more. And so if you're on it for a long period of time, it's not going to do a lot of good until you get more.
Okay.
So
what are some of the other concerns besides, when you say short term, are we talking weeks? Are we talking a month or two?
Generally, we try to keep people on a week or less.
Okay. So really short term.
Really, it really
is.
Really
short term. And you'll find folks in the community that are taking it for chronic pain issues. And that may not be the right course of action.
It sounds like it. If you're talking short-term, chronic is not short-term.
No, it's not. And we really try to avoid that if possible.
Okay.
Right.
So, go ahead.
I was going to say a couple of things in general about medication. Opioids are very specific, but medications interact with other medications. So you really want to make sure that you're paying attention to what you're taking and sharing that information with your physician. A lot of folks take over-the-counter drugs, medications. They don't really realize that it may have an interaction with some other medication that you're on. So make sure you talk to your physician and your pharmacist. So it takes a team of effort to manage medications.
So that's actually what I was going to ask about. What other kind of things do we need? So you've got a legitimate prescription. It's really only for a week or so. What else do they need to be worried about? I'm guessing, besides those other drinking.
Sure. So mixing medications, like she said, opioids can make you, there's a lot of side effects to opioids. So it can make you dizzy, sleepy, your judgment can be off.
Yep.
It can affect your short-term memory and your ability to reason things out. And so it can affect your judgment. So if you're taking those opioids and then you mix it with, for example, Valium or other Ativan or some other medications or antidepressants or other medications which also have similar effects, then those effects can compound and build up on each other and can cause problems. In the elderly specifically, it can cause a lot of dizziness and weakness and falls, which is one of the biggest problems we have, is falling because of people on opioids.
Yeah, absolutely. And like you were saying, Lisa, most medications don't mix with alcohol. You really should not even try that, especially don't operate machinery with those kinds of medications. Your car, you want to be very careful.
And people don't think of a car as machinery, but it's a pretty big piece of equipment.
It's sometimes the only way that people get around.
Right.
And if you're taking a lot of medications and you might have a drink or two, that can have a huge effect, especially if you're an older person.
Because
you
sometimes just
metabolize
one
it.
drink will you
Right.
could 20 years ago have a couple and over an evening and think you were fine, but one drink can really impair
Your
you.
metabolism is different. Your circulation is different when you're older. And so you may actually be harboring the medications or keeping the medications in your system longer. So that has a huge effect on your ability to be able to handle that.
So let's talk about those risks of overdosing. It seems like, Jill, when we talk, don't we have one of the highest overdose rates in the state in this area?
Oh, I don't even really want to talk about it. It's a little... I wish we could get a handle on it. We're trying very, very hard. This past year, we lost 41 people to overdoses. And I'm not talking about heroin. I'm talking about the medications that Dr. Evans was talking about. So the fentanyls, the morphines, hydrocodone, those kinds of things were listed, and the toxicology is the reason for the death. So that's very, very important that we try and stop that. However, a lot of people will actually overdose, but luckily they're saved from that, but they end up in the hospital. And we actually track those numbers. A number of studies have been looked at, numbers for Muskegon County from Medicare data, not Medicaid data, Medicare data, and we ranked 8th in the nation as far as hospitalizations for opioid overdoses.
Oh my.
8th in the nation. Yeah, as far as counties, and there are 3,000 counties in the United States.
I mean, even in the state, there's 83, so we're in the top 10% or bottom 10%, I guess, depending which way you look.
And Medicare data is for patients 65 and older generally.
Right.
So there may be some that are not, but most of them are 65 and older. So we're talking about patients who are in the
talking
age
about
group that
older
we're
adults.
addressing here. Yes.
That is who we're talking about.
So how can somebody protect themselves? How can somebody protect themselves from an overdose? Or from, are there tools that help them manage their medication and how they take that we can talk about?
Yep, take your medication as it's prescribed. You want to take it at the time it's prescribed. You want to take it at the dose it's prescribed. You don't want to take 2 at once. You want to share all the medicines that you're on with your pharmacist and your physician. And I'm talking herbals too. There are some people out there that, with the marijuana right now, that are ingesting the CBD oils. That is an herbal. Please make sure you share that information with your provider to make sure that they're looking at everything that you're on at this point.
Even if we don't talk about the marijuana, and that's legal, I know now, and there's a lot of that. But there are other, if you go, to the health hut or someplace like that, there's a lot of other
St.
natural
John's
things.
wort,
Right.
any kind of herbals. Yes.
There can be interactions there as well, I would imagine.
Absolutely.
There can be interactions with most any medication, especially the ones that are used to help you sleep and help you
That
rest.
too, yeah.
That's going to make you more drowsy than the medication you're already taking. So just you have to be aware of that.
Yeah. And so, if you're taking a medication and you're not comfortable taking it, if it makes you not feel well or it doesn't fit your lifestyle, definitely talk to your physician and your pharmacist about those issues. Oftentimes, dosage can be changed, or potentially the medication can be changed. The time that you take it could be changed. They'll work with you on that to make sure that it works for
But
you.
people shouldn't just take it upon themselves to say, this is the last thing added, this is making me feel different, I'm not going to take it. And,
Right.
and I think there
Right.
are people who will do that. Well, this is the last thing that changed, so
Right.
I don't want to call, or I won't be able to get in, or I don't want to bother
Right.
them, or whatever. But no, they need to
Yeah,
call.
tap into those resources.
I think people also have to understand that many of these medications like Norco, Vicodin, OxyContin contain Tylenol in it as well. So if you take that, plus you take regular Tylenol, you may actually be getting an overdose of Tylenol, which can be a real problem as well. So that's an issue that people are not aware of, and that they need to be aware that some of these medications are combination medications, not just independent medications.
So how would somebody know if they have a problem? What are some warning signs of addiction, or just the interactions even?
Well, Dr. Evans talked a little bit about those. I have some more on my list because there's actually quite a few. I was really surprised when I did the research on this, and there's some things when you think about older folks that you actually see a lot, and it made me wonder whether or not maybe their medication should be checked. So some of the things like you talked about, coordination, trouble finishing sentences, concentration on things, unexplained bruises, unexplained chronic pain, which I found to be very interesting, considering what we were talking about and having to up the dosage.
It's kind of like a
Medications.
vicious circle then. You've got
Can
pain,
be,
and you
yeah.
take some more, and now it's compounded itself to be pain in a different area.
Right, and so then there's issues with depression. A lot of times the shut-in effect, you don't want to visit with your friends, your family, your neighbors, those kinds of things, that can be an indication that there's something wrong with your medication.
So that's something that a loved one should be looking for as well, because especially when we talk about the confusion, and we have so much awareness of dementia and things, that a lot of times people will look and think that, oh, there's dementia setting in, when what people don't realize is how many other things can mimic some of those signs of dementia, the
Sure.
confusion and the forgetfulness and all of
It could
that.
definitely add to it.
And I think one of the big things, one of the most common side effects we see is constipation. Just the bowel slows down because it slows down everything, and so it slows your bowels down, and so you can get constipation from that, fairly severe constipation at times, causing abdominal pain and other things. You can get urinary retention, so you can't pee as well. That can be affected as well. So there's a lot of different possibilities and side effects. They can be pretty serious, and the biggest one is the dizziness and the falling. So people are falling and breaking a hip because they were on a medication for leg pain or something like
Right.
that. Now they're
hospitalized,
Right.
now possibly having to go
Surgery.
to rehab, then there's pain, so then
Right.
we're compounded with the
Right.
medication.
Yeah, here we go again, right?
Yep.
Right, and then I would imagine, as somebody becomes addicted, or at least very dependent on things, that getting them off of that is a challenge as well.
it can be very much so, yes.
So what resources are there if somebody thinks they've got a problem with this, that they've become addicted to this, just through some of those examples we gave, that now something started and it's gone down, now we've been taking medications for a while because of all this pain?
First thing, talk to your doctor about it. If it doesn't feel normal, it's not normal, okay? You need to talk
Trust
to your
your
physician.
instincts.
Oh, absolutely. If you can't talk to your doctor, make sure that you talk to your friends, your family, your loved one. Maybe you have a caretaker. Talk to them. The one thing that we can try and do the best is to get you into treatment resources. There are a lot of things a physician can do. If it's too far down the line, sometimes we actually have to get you into some programming that's a little more serious.
And it's not something like we like to talk about, but when we do have people who have developed an addiction to these legally prescribed medications, and then their prescription runs out and they're not getting a refill, they're turning to street drugs sometimes, aren't they? I mean, again, I think this is where you think, oh, that's not older adults, they're not going to do that. But do we see that?
Oh, yes, we do.
Yeah.
Like, what kind of street drugs are we talking? I mean, to me, that was kind of one of these, really? People are...
Yeah.
That leads us right into the diversion piece.
Right.
We'll talk in a little bit about the lockbox program. Keeping those medications that you may have that have a street value to them locked up prevents diversion from getting them on the streets. And therefore, people actually being able to purchase them. Don't share your medications with
Right.
people. That's a big deal, too.
What about if somebody doesn't need, they've got a prescription and they don't need it? What should they do with that I mean, because sometimes people just leave it, well, then I'll have it in case I have an issue down the road. Or my
Happens all the time.
husband might need this down
Happens
the
all the
road.
time.
Or, and then either they're expired and you're taking something you shouldn't, or somebody else comes across it and takes it. What should they be doing for that?
We strongly urge people not to save medication. Obviously, it's once the prescription is done and you're done with it, we really want you to get rid of that medication. A lot of our fire departments and other areas here in Muskegon County have medication collection days where they actually collect medication that's left over in your home, and they have taken in thousands and thousands of pills off the streets from that because of people turning in medications. And the other thing is that having those medications in your house, if there's any kids around, they can get hold of it. People can take it and divert it, like we were talking about, and sell it to other people. So we need you to get rid of it. I think pharmacies generally have some way to get rid of them as well.
Yep.
I think
The
some of them
police-
have ongoing, because I think when I've
Right.
been to Meyer, they actually have something there all the time now. where you
Every
can-
single police department in Muskegon County has a drop box where you can drop off unused medications anytime you want. It actually looks like a mailbox out front, and you don't have to take them out of the little pill pill keepers, whatever kind of pill keeper you might have for that. You can actually just put the whole thing in there, no questions asked. It doesn't have to just be a controlled substance. It can be over-the-counter medications too. To be honest with you, sometimes those medications, if they're not expired over the counter, I'm thinking like acetaminophen or those kinds of things, they can actually take them out and reuse them until the expiration date is there if they're in a sealed package. So it's a little bit of recycling, and it's good for the environment.
Because they should not be flushing them.
Should
No,
not be
please
flushing
don't.
them.
That goes into the water
Right.
system, and that can't all get filtered out by our, even as good as our water filtration plants are.
That's
that can't
right.
happen because
No.
they're going to dissolve, right?
Right.
A lot of
Absolutely
them.
right. Yeah, and then it prevents diversion on top of that. So the police actually take that and have them incinerated under secure conditions. So it's a good thing to do.
Absolutely. So let's talk a little bit about that lockbox.
Yeah, you want to see it?
Yes, I want to see it.
I
So
brought-
I know you've got a new
I brought
program
one.
at Public Health funded
Yeah.
through a grant for these lockboxes. So tell us all about these.
Yeah, the everybody's been trying to do a little bit of everything to resolve issues around opioids. The state granted the public health department here some funding to be able to assist us with programs that we're already working on, so efforts that were already going on in the community. One of them was preventing diversion, so we were lucky enough to get some lock boxes. I have quite a few of them. They're stacking up in my office, so if you could spread that around to your friends and neighbors to come and get them, but we have them. They're free to Muskegon County residents. I'll open one up so you can see inside here. We have some documents that come with it. There's actually, we were just talking about where to dispose of your medications. That's in there. You can get all this too without actually getting the box too. I'll give you this information if you want it. Some information about taking your medications, just like we're talking about here today, and then a little registration form. We try and keep them to one per household, but we know a lot of folks take a lot of medications. We do make exceptions to that. But anyways, this is one of them here. They're available at the health department if you want to pick one up there. And then we have some other locations, and give me a buzz if that's not close enough for you, if you're homebound. We've actually hand-delivered these to folks, too. So the only thing we're asking is that if you're done using it, that you bring it back to us so we can give it to somebody else to use.
Great.
Yeah.
And you got 500 of them?
I have 500 of them right now.
Okay, so you've probably got some of them out, but
We do.
what's the phone number that?
It's 231-724-6350.
Okay.
Would be the number, or they can just call the health department,
Okay.
and they know where I am
They can always,
in the building.
You can always call 211 if you don't remember that. We talk about that all the time at the end again.
That's
but
great.
They are very aware of that.
Yeah.
So that seems like that's a really great way to try to stop some of these things from going
Yep.
where they shouldn't.
Yep.
It stops a kid from getting, grandchild or something from getting in. Or,
Right.
we've got to be honest. Sometimes if people, you've got people who are looking to take advantage of an older adult sometimes, and
Right.
sometimes unfortunately it's a family member, but it could be a neighbor, it could be somebody who comes in, sees that counter with, the plastic tubs full of all the different pills, doesn't know what they are, but figures there's a good chance there's something in there.
I've had reports. I've actually had folks call and ask for the box and talk about their situations, and they'll say that the guy that cuts their grass or the gal that cleans their house, and they'll end up with missing medications. So this, you can break into this if you really want in it hard enough, but it's just something to stop them.
So obviously they get that. You still don't want to keep that right out on the counter because it's not, like a safe that you couldn't.
Right.
You still want to be careful with it.
Right, and there is.
And what shouldn't they keep in that, though? There are some medications, like I'm thinking of an EpiPen, if you had a bee allergy or something. There's things you want to be able to get to quickly. What shouldn't be kept in that?
Well, nitroglycerin probably would be.
You want to keep that on you. So nitroglycerin, EpiPens, things like that. That if you are prescribed those medications, you should keep those on you.
Something for an emergency that you might need.
Right.
And then there's some refrigerated medications. Not many anymore. Most of the medications are not refrigerated anymore, but there are a few. So you wouldn't want to keep your insulin in there, for example.
Right.
So
something like that. But the things that you've got, like I need to take one in the morning and one at night or whatever, are good to do there.
And this actually, there's an attachment for a counter, so people can't just pick it up and walk away with it. The other thing that's kind of neat about it is, it's got a handle on it, so you can travel with it. Just take it with you where you go. Which is really pretty neat, huh?
Right, especially because certainly if you're in a hotel or something, you've got housekeeping in and out. And we're not trying to say that the world is full of dishonest people, but we know there are some.
There are opportunities.
And if somebody's got an addiction to a drug, we know from all kinds of stories that can lead them to desperate measures. Sometimes we're just trying to protect the greater community, the older adults and other people from trying to do that.
We do have reports from the hospital of children, childhood poisonings. So, that's a significant concern.
And I would imagine that would just break anybody's heart if they found, the guilt that they would carry from something like that.
Right. Yeah, so call me. I'd love to give you one.
Okay. We'll make sure that we've got that information. Let's talk a little bit, Dr. Evans, well, both of you, but legislation. I know there's been legislation introduced recently dealing with medical providers, I know there's been a lot of conversations locally about trying to talk. It's not all on medical providers, but I know that there's been a lot of talk about how we can limit those prescriptions, keep them more short-term. Talk to us a little bit about some of that.
So the state of Michigan recently, the law was passed some time ago, but it recently went into effect where they limit the amount of medication you can write on a prescription without checking a database. The state of Michigan has a database which tells us how many prescriptions, narcotic prescriptions, or any controlled substance prescriptions a person has received anywhere in the state of Michigan. So, and actually in other states surrounding us as well. So I can go into that database and see, has this person received a narcotic prescription recently, or a controlled substance prescription that might interact with the one that I'm giving them. So, and then I can talk to them about that. And there are also talking points that we have to have that we use in talking to people when we do give prescriptions for narcotics. And so that's all part of a state law that was recently enacted. So,
do you feel like that's going to help things?
I hope so. I think there are some people who have been writing a lot of prescriptions that maybe more than should, but I don't think that's the most common thing. I think that generally people are reasonable about it. But I think it's really heightened the awareness and made people more aware of what they're writing and why they're doing it.
Right. Patients need to be aware of those things too, because there are certainly, I'm sure, people who will go doctor shopping until they can find somebody who will do that. So is this database actually new?
No, the database has been there a long time.
Okay.
We've used it for quite some time, and it's been accessible to any physicians. The nice thing Mercy Health has done is now linked it to our patient records, so we can just one click and we don't have to sign in separately. So it works very well for us.
Your time and all that. Let's talk a little bit too about the role a pharmacist plays, because certainly your physician is the one prescribing, but the pharmacist has a lot of knowledge as well about drugs, and sometimes maybe less than doctor shopping people, pharmacy shop though, I think. Because of course prices are different and everything, but what role can a pharmacist play in helping with this?
Well, pharmacists they have access to the same database that we do, so that's very helpful. Plus if a person gets all of their prescriptions filled at one chain or one pharmacy, they can look back and see what medications they've gotten recently, which is very helpful. A lot of times patients don't know what their medications are. And so our pharmacists are able to check into that and link with that database. So that's been very helpful. And I think that pharmacists have a great deal of knowledge about medications and medication interactions, and they can talk to people about, well, you're taking this and this and this, and all three of those can make you drowsy, so just be aware of that. Or they can call us up and say, hey, did you know that this person is on this medication that may make them drowsy as well, and do you want to continue to do that medication?
Right. So it takes a team is really what it does. The pharmacist, I know you just see him counting pills back there, but he's worth a lot more than that. So take advantage of that.
And they've gone through a lot of schooling to, not the same level as med school certainly, but a lot of that, and I imagine a lot of continuing education that they need to do.
They have a lot of schooling and a lot of education. So they really
a PharmD is actually 6 to 8 years of study in pharmacology. So they should be partnering with the physicians here in the community to manage medications. You physicians concentrate on a lot of other areas, a little bit on the pharmacology, of course, but not nearly as much as a pharmacist. So take advantage of that person behind the counter.
And sometimes I think we may feel more comfortable going to a pharmacist because we can see them right there. And we know how busy doctors are. We know that we don't get as much time for conversations a lot of times as we would like to. So I think that's a really important part. So do you have pharmacists on your task force and your opioid task force?
Absolutely, of course. The task force is all walks. We have folks from the hospital. Dr. Evans is on our task force. We also have treatment personnel. We have law enforcement available to us. Social workers, the churches are involved. All of us are trying to overcome these issues and make connections, making sure that people actually are aware of the hazards, making sure that they're getting screened for potential problems, and making sure that those folks that are screening them have access to and knowledge of all the resources in the community. So it's really, really great group. We've been together a few years now, and I think we're starting to make some headway, I would hope.
Well, I mean, I was so excited, and my colleagues at Senior Resources were really excited when I said we were going to talk about this because, as I said earlier, we talk about it a lot with younger people, and there's a lot of the same issues that are in common, but then with older adults, you've just got another whole level of risk where probably falling isn't as critical of an issue with a 20-year-old. I mean, they might fall still. I'm not saying those things won't happen, but you're not going to have the brittle bones and some of those things that are going to be as likely. And frequently, they're going to have more people around to care for them because we have a caregiver shortage, which is a whole other topic. So we are down to our less than a minute now. So I just want to thank both of you. This has flown by, such good information. We really hope that people will check into this, check out these lock boxes at Public Health, 724-6350, or if you can't remember that, you can always call 211. They have all of this information as well. Jill and Dr. Evans, thank you so much for joining us today.
You bet, anytime.
And
Thanks.
We'll see you next month. Thanks for joining us.